nchini. Na mtazamaji, asante sana, karibu tena, ikiwa ni siku nyingine Ijumaa, tarehe ikiwa ni 13 mwezi wa 8 mwaka 2021. Kama kawaida katika ukumbi wetu wa Okoa Mombasa, kama kawaida katika ikifika siku ya Ijumaa, huwa tunaweza kuangazia wewe mtazamaji, wewe Mkenya na wewe mhusika katika masuala tofauti tofauti jumla. Siku ya leo siko peke yangu kama ilivyo kawaida, kama ilivyo ada, naye mgeni wetu siku ya leo na ataweza kujitambulisha, ataweza kujieleza yeye ni nani, na katika mazungumzo yetu tutakuwa tunazungumzia mengi sana, hususan katika kitengo cha afya, yale yanayojiri katika taifa letu la Kenya, yale yanayojiri katika kaunti zetu 47 kwa ujumla. Katika kila sehemu tutakuwa tunagusia ndani ya jisa letu limoja. Kama kawaida, mimi nafahamika kama Ismail Zema, na niweze moja kwa moja kumkaribisha mgeni wetu siku ya leo. Karibu sana daktari, uweze kujitambulisha kwa wananchi, wewe ni nani, unajihusisha na nini, na tuzungumze zaidi.
Thank you very much, Ismail. My name is Dr. Bidan Mwachi. Current position in the country is that I am the national chairman of the Doctors Union, KMPDU, and I'm also a consultant general surgeon, currently practicing at the Coast Provincial General Hospital, the former Coast Provincial General Hospital. Right now it is referred to as a Coast Teaching and Referral Hospital. Yes, I've also been a member of the Equity, actually the technical person of the Equity COVID response team, and I was the coordinator and the technical person for Coast Province until I resigned.
Okay, Doctor, for the sake of Mwananchi, I think we should change from maybe to the national language. Yeah. Kama utaweza kuchanganya Swahili, English,
I will try, mate.
Vizuri kidogo, yeah, kwa faida ya yule anayekusikiza. Labda uweze tu kufahamisha mtazamaji, wewe ni mwenyekiti wa muungano wa madaktari nchini. Labda kwa ufupi tu, KMPDU kwa mwananchi aelewe ni nini?
KMPDU ni chama cha madaktari kwa in full. KMPDU inasimamia Kenya Medical Practitioners, Pharmacist and Dentist Board. Hivi kwamba KMPDU inasimamia madaktari wote wanaofanya kazi katika idara ya umma na pia wale ambao wako katika sekta ya kibinafsi. KMPDU ndio huwa chama ama mwongozo ambao unatetea sio madaktari peke yake, bali kwa ujumla vile pia masuala ya afya katika nchi ya Kenya.
Masuala ya afya katika nchi ya Kenya. Kwa hiyo si madaktari peke yake, kuna wahudumu, kuna hao wengine ambao pengine ni mtu tu anafanya kazi katika jamii, kuna madaktari wa jamii, wale wa nyanjani kule kwetu tunaona pia nyinyi mnatetea kama hao, ama madaktari peke yake? Na
hususan kabisa tunatetea wote, kwa sababu afya is a system, healthcare is a system. Ukiangalia kwamba kama kuna wale wauguzi ambao hataweza kupata haki yao, kwamba minajili ya kufanya kazi yao kwamba imezoroteshwa, basi the entire healthcare system also will have a dent on it.
Ukizungumzia kuhusu utetezi gani? Labda pengine ni utetezi wa mshahara, ni utetezi wa utendaji kazi bora, ni utetezi kwa ujumla, ni utetezi aina gani?
Wacha niseme kwa kimombo kwamba activism in health sector revolves around many spheres. One of them is better remunerations and better working conditions, but most importantly is that you stick on the point of better working conditions, because with better working conditions you get better service delivery. So in essence, what we agitate for and what our activism is about is better working conditions, and that translates directly into better health delivery to the common mwananchi.
Miungano mingi imekuwa ikinasibishwa na kukosana na serikali, tumekuwa na ile mgongano kati ya miungano na serikali. Wanasema kwamba pengine huwa mnaingilia kazi zao, huwa mnaingilia majukumu yao, huwa mnawapeleka mbio zaidi. Swala kama hili unalishukuliaje kama mwenyekiti wa muungano wa madaktari nchini?
Si kweli kusema kwamba huwa tunapeleka mbio, ila kwamba kuna wakati mwingine ambapo huwa tuko na tofauti za kimitizamo, and then when it reaches such a point and each side has to pull towards its own end, kwa sababu vile wanafikiria kwamba matakwa yao ama maono yao kulingana na swala moja ama lingine ni la uzito zaidi kushinda ile pande nyingine. Kwa hivyo ikifika wakati kama huo, msukumo ni lazima, na huwa sio kwa sababu ya kwamba tunataka tukusukumana. Sisi sote huwa tunafanya hivyo ili kuboresha utekelezaji ama utendakazi katika sekta ya afya.
Ni muda kidogo tuliopita tulikuwa tunaona kwamba kulikuwa na si mgogoro, lakini mlikuwa mkitupiana maneno kiasi na serikali kuhusiana na hili janga ambalo liko, kuhusiana na vitu ambavyo vinastahili kuwa. Swala kama hilo, kwanza tueleze tu lilifikia wapi, tuingie kwa kina tuzungumze swala la corona.
Kwanza kabisa ukikumbuka tulipoanza kukadiria janga hili la corona, serikali nyingi katika dunia nzima zilikuwa ni kama hazina uzoefu, kwa sababu hili lilikuwa jambo mpya katika nchi hata zile ambazo ziko na wajibikaji wa wastani. Most of these countries did not have the capacity. It was largely an unknown virus, largely an unknown pandemic, never handled before. So the governments were grappling, and it took them a long time for them to realize that we have to incorporate the healthcare workers. We have to incorporate key stakeholders, which includes unions, doctors and nurses and clinical officers, associations, so that they also become a voice and part and parcel of the agitation or part and parcel of the containment measures, the ideas, the filling up of the idea gaps in towards, culminating in towards better provision and better containment measures for the virus. So it took some time for the governments to realize that we are not adversaries, that we are part and parcel of the same team, since we are all concerned about the pandemic because it affects us in a bipartisan way, both sides.
Kama mtaalamu wewe, kuna sasa hivi bado kuna mmoja katika zile sehemu za ndani kabisa, pengine ukienda Murang'a ndani kabisa, pengine ukienda Kakamega ndani kabisa, kule ukielekea Kwale ndani kabisa, hajui corona ni nini. Kwa ufahamu wa kidaktari, labda umfahamishe mwananchi ambaye anakusikiza kwa ile lugha ya kawaida, corona ni nini?
Itakuwa rahisi kueleza kwa lugha ya Kimombo, lakini nitajaribu kwanza kwa lugha ya Kiswahili, alafu ile kwamba ile ujumbe isipotelee katika lugha, nitaeleza kwa lugha ya Kimombo. Corona ni homa ya mapafu kama vile ambavyo inajulikana pneumonia, type of pneumonia. Tofauti ya corona na hizi pneumonia zingine ni kwamba corona ina uambukizaji wa hali ya juu zaidi, ile infection rate yake iko juu zaidi. Pili, corona kando na homa zingine za mapafu ambazo zinajulikana, ambazo tumekuwa nazo kwa miaka na mikaka, inaweza kuwa kwa njia ya urahisi zaidi, na vile vile ni homa ambayo haijajulikana kwa muda mrefu. Kwa hivyo ubunifu na uzoefu wa kutibu ugonjwa huu wa corona ni kama jambo ambalo halijazoeleka katika muktasari wa wanasayansia.
Kwa hiyo unamaanisha kwamba corona sawa na virusi kama virusi vya malaria, virusi kama vile vya ukimwi, virusi kama vile kama ulivyozungumza homa la mapafu, lakini kirusi hiki cha corona kina uzito zaidi ya hivi vingine?
Haujakosea sana, ila tu nitakosoa kidogo. Malaria sio kirusi. Malaria ni inasambazwa na chembe ambazo zinaitwa protozoa. Corona ni kirusi. Virusi vingine ambavyo vinajulikana kama virusi vya ukimwi, virusi vya homa ya mapafu, influenza virus, homa ya kawaida pia inasababishwa na virusi, ile dengue fever, ile Marburg virus, Ebola, hizo ndio ambazo zinakuwa categorized pamoja na corona kama viral infections.
Daktari Abidan, kwa upande wako wewe kama mtaalamu saizi, labda utupatie taswira tu ya hali ilivyo katika taifa letu la Kenya, nchini Kenya, kuhusiana na swala hili ya magonjwa hili ama virusi hivi vya corona. Tupatie tu taswira ilivyo katika taifa letu la
Kenya. Kwanza kabisa, a good place to start ni just to inform us where we are, that we are deep into a third wave, and unlike the other waves before, we are seeing a wave originating from a mutant virus. What do I mean by this? We had the original coronavirus, which originated in Wuhan, and as is characteristic of any virus, they mutate over time. And now we have the fourth mutation. We had the alpha mutation, the beta mutation, the kappa mutation. Now we are at the delta mutation. Alafu tuelewa kwamba pia your delta mutant ya coronavirus has also undergone another mutation called the delta strain, or the delta plus virus. And globally, we want to say that Up to now, there is no country in the world that has not been affected by the coronavirus. We have already seen the characteristics of coronavirus, that it's a dangerous virus. It spreads very easily, not as much as chickenpox, but it spreads very easily, and it spreads through droplets, and also that it can affect any part of the body. And lucky to us, we already have a vaccine. What you need to know at this point in time is that in our population, about 7-8 billion people in the world, 4 billion people have been vaccinated. And we have seen a lopsided or unfair share of the vaccines coming to the less developed countries, like in sub-Saharan Africa and some parts of the Middle East where there are war-torn areas. But the richer countries have had a very good vaccine penetrance rates of sometimes up to 60-70%. But when you come down to sub-Saharan Africa, we are talking about vaccine penetrance of about between 1 and 3%, which is very floppy and very dangerous if you're to contain a pandemic that is of worldwide proportions. Yes.
Sasa hapa Kenya hali iko vipi?
A good place to start will be to say that we do not have accurate statistics. Kwamba zile hesabu ambazo tunapewa na idara ni hesabu ambazo zinakisia tu, ziko karibu na ile accuracy level, but you are not yet to a point where we have the exact statistics about how many people are infected, and we also have no way of knowing at this point in time. It would have been easier earlier on, but right now the virus and the pandemic has moved from being in isolated groups, and now it's a community disease. Once it's a community disease, and also culminating from the fact that a majority of the people will be largely asymptomatic. So it is hard to know exactly today how many people have been infected or how many people are infected right now. It's also hard to know how many people have died from the virus. Because of our cultural beliefs, people die and they're buried the same day. We don't report to the health operatives. And even if we are to report, our model of reporting deaths is a little bit skewed and ineffective, in that most of these things are handwritten. When you die in a hospital, it's handwritten. Then on a weekly basis, it's taken to a central recording place. Then after 1 or 2 weeks, that's when now it's integrated into the system. So it's hard to catch up. Like on a daily basis or on a weekly basis, how many people have died from the virus. But up to now, what you know as far as the vaccine is concerned, Kenya has managed to vaccinate around 1.8 million people, that is the first dose, and about another 800,000 people, that is the second dose. Those are the ones who are fully vaccinated. This represents about just 1%. That is to say, when you walk out here, for every 100 people that you meet, only one person has been fully vaccinated. When you say 1.8 million people have been vaccinated, what is our target? The target should be the adult population of the country. The adult population of the country is 26 million. So you're far way beyond what our target is, far way down beyond, and there is nothing to show that we're going to achieve that target anytime soon.
Tutakuja katika hilo swala la chanjo, daktari, kwa sababu ni mengi ambayo yanajiri katika hili swala la chanjo. Na tumesikia mengi, tunaona mengi, lakini turudi hapa bado, wewe kama mtetezi ama muungano, mwenyekiti wa muungano wa madaktari nchini, umepata nafasi ya kuzunguka katika hospitali tofauti, umepata nafasi ya kutembea katika kaunti tofauti. Tupe picha, taswira ya hospitali, kwa sababu tumekumbuka, tunaambiwa kwamba wakati mwingine vitanda havitoshi, wagonjwa ni wengi. Wewe kama mwenyekiti, tupe hii picha. Kwa nini vitanda havitoshi, na je, ni kweli vitanda havitoshi? Je, ni kweli huu ugonjwa katika mahospitali upo kama mtaalamu?
Ismail, you allowed me to express first great reservations as to the measures that have been put in place to contain the virus. Right from the start, the picture painted out there is a sorry state. Away from the figures and the 10-point plans that we see the Ministry of Health coming up with, the situation's a little bit more sorry than is told. It comes a time when there's a spike, like now the previous spike that there was, and there were no beds at all, whether you had money or you did not have money. There were no beds, and so it was equal scramble for anyone. You will not find an IC bed wherever you go. and the one or two that will come about because a patient has died, so there's a space that has come about, people will scramble for it. And this was across board, not just Mombasa, it was across board the country. I remember when this pandemic hit us first in March 13th, we had some measures coming up from the county government, setting up, Mombasa I think set up 400 beds temporarily at Technical University of Mombasa, at Coast General, at Chuda, and several other private hospitals. But at some point we dropped our ball, and not being keen to the advice by scientists that, viral infections like this, viral infections of an infectious nature like corona will come in waves and spikes. So at that point when we dropped our balls and closed down these facilities, trust me, these facilities were closed down before proper scientific evidence supported their closure. So when the waves started hitting, we found more numbers. And the second wave will come with a more dangerous strain, and the third wave will come with an even more dangerous strain. So what we are left with were inadequate facilities, mostly closed down, a skeletal staff that will not be able to manage the rising numbers and the severity of the diseases, and very few ICU bed spaces. And like for instance, a county like Mombasa would now be the epicenter of treatment for the entire Coast Province. Kilifi is shut down. Never even took off its COVID center. We can say the same about Kwale. What we had are just beds that can't do much. Taita Taveta, probably nothing was going on there. Lamu, so Mombasa was an epicenter of managing of all this. And then I put this in the backdrop that when the 2021-2022 budget came, the national government, in its own wisdom or lack of it, scrapped out what is called conditional grants. What is conditional grants? Conditional grants is money allocated to the former provincial hospitals like Coast General, like Embu, like Nyeri, that was supposed to cater for patients who come in to, for example, Mombasa, and they don't reside in Mombasa, so that we have some form of equilibrium. The patients will come from other counties, but for them to get treatment here, there was some form of a conditional grant that will come to this. That was scrapped out. So what this leaves us is with just bare hands, open nose, open mouth, and nothing really moving.
So you mean there are no improvements kwa hizi hospitali, pengine mabadiliko yote kama unavyozungumza? Hakuna mabadiliko yote tangu gonjwa hili liingie katika taifa letu?
To be fair, there have been some improvements. We've seen Mombasa Cement company donating an oxygen plant. We've seen a few rises in the number of ICU beds, not in tandem to the rising COVID cases, of course. We are far behind what you're supposed to have as a population. ICU beds to population ratio, far much beyond that. If a catastrophic phenomena like a hard-hitting wave comes, we will still be grappling in the dark.
Labda tukuje sasa katika upande wako, wale watu ambao umekuwa ukiwatetea. Tumekuwa tukiona vitisho kwa wahudumu. Kuna wakati kuna baadhi ya wahudumu walikuwa wakipelekwa mbio, wakifutwa kazi kutokana na kwamba pengine wanaitisha vile vitu ambavyo wanahisi kwao ni muhimu kufanyia kazi, lakini hawavipati. Counties wamekuwa, watu wengine walifurishwa katika majumba yao, ukapata mtu anatolewa katika nyumba yake, mwingine anajipata asubuhi anaambiwa toka, mwingine anajipata pengine mshafutwa kazi kwa sababu ile kutetea yale ambayo alikuwa anahisi kwake yeye ni muhimu kwake. Labda tuzungumze sasa hivi, tulizungumzia swala kama hili. Je, kuna mabadiliko ama hali bado ile kwamba kuna mvutano kati yenu nyinyi na pengine na serikali za kaunti?
Mivutano bado yapo kwa sababu ukiangalia kwamba mpaka sasa wahudumu wa afya nchi nzima isipokuwa kaunti labda 2 ama 3 hawajalipa wafanyikazi mishahara yao mwezi uliopita. Vile vile ukikumbuka kulikuwa na ile COVID risk allowance ambayo Mheshimiwa Rais aliwapa wafanyikazi wa afya, nayo ilikuwa kwamba ilikuwa ya miezi 3 peke yake. Hivi sasa tunaelekea mwaka wa 2 tukiwa na janga hili la corona. Ile COVID risk allowance iliweza kutolewa na kutupiliwa mbali, na sio kwa huduma wa afya peke yake. Nakumbuka kwamba kulikuwa na pia ile COVID relief fund ambayo iliweza ku reduce ile inaitwa pay as you earn kutoka kwa wafanyikazi wote wa umma from 30% to 25%. Then at the beginning of this year, that pay as you earn was again removed. What this meant is that when you're locking down a country and making the ones who are working again pay the high rates of pay as you earn in taxation, you are exposing them to more and more turmoil because the income is reduced, but you're expecting pretty much the same amount of taxes from them. So there's still been has been back and forth. Well, failure to pay salaries, shortages of healthcare workers, shortages of PPEs, inadequate hospital facilities. And what this means is that increasingly health workers have been superintending upon deaths as opposed to offering care and cure as they're supposed to.
Labda tukizungumza hivi sasa, kama nyinyi wataalamu, utapata kumetokea visa vya wataalamu wakiweza kupoteza maisha yao katika taifa letu la Kenya, na wataalamu wenyewe wanasema huwa ni watu wachache sana katika taifa na hususan hapa Kenya. Picha kama hii, wewe kama mwenyekiti wa muungano wa madaktari nchini, inaashiria nini kama wataalamu tunawapoteza wao ambao pengine wangelikuwa natupatia njia ya hivi na hivi, lakini tunawapoteza kutokana na hili janga? Inaashiria nini?
Ismail, worldwide we have lost about 120,000 healthcare workers to the COVID, and that's a modest figure because there are others that have not been recorded. So if we're to cumulatively record all of them, we're probably talking about 200,000. That's a population of almost an entire county. And Kenya alone has lost about 80 healthcare workers, and that is what has been reported. You figure out and add the other ones who have not been reported, and the number is staggering. And specifically for Kenya, when we have a very bad patient-to-doctor ratio, WHO recommends one doctor to be available for 1,000. In Kenya, we have one doctor to 16,000. And we go to other subspecialties like psychiatry, we have one doctor per 1 million Kenyans. When you lose one life, that is one life too many. That has created a lot of disparaging remarks from the doctors, from all healthcare workers, and it has made the morale very low because, you know, first of all, you don't have insurance. Second of all, your salaries are delayed. Third of all, your numbers are inadequate. You're supposed to work in a COVID isolation center, in a COVID HDO ICU. And what that means is you're not only exposing yourself, but you're also exposing your family, and to no benefit. So it more or less looks like a martyrdom mission, which shouldn't be the case.
Na labda pengine tukizungumzia yale maisha ambayo mnapitia kama wataalamu, kumekuwa na swala la kuzungumza kuhusu familia. Kuna wakati nilizungumza na mhudumu mmoja akasema kwamba ana miezi miwili hajafika kwa familia yake. Familia anahisi kama ametengwa na familia. Kuna hii stigma ambayo imekuwa ikitokea kati ya madaktari na familia zao. Nyinyi kama muungano mnadili nayo vipi kwa hawa ambao wanahisi kwamba wametengwa na familia yao, kwa sababu wanajua wewe unahudumia mgonjwa ambaye ana corona, wewe uko katika wodi ya mgonjwa wa corona? Watu kama hawa mnawapatia moyo vipi na mnazungumza nao?
Society is right in making that barrier between a person who has been exposed and themselves. It's right in ways more than one, and it's actually self-preservation because, you know, corona is contagious. Now, if you've been attending to patients who've had corona, and we are getting from the media that the PPEs so provided are substandard, so I have every right to self-preserve. So the impact on this has been to the mental health of the healthcare workers, and mostly in three fronts: anxiety, depression, and very, very innovate mental issues of deep depression, anxiety, because they do not know what will happen next. You're here at the front line, but yourself, you're not immune to the virus and its consequences. And then you have to go back to your family. You're exposing them to the ones who agree. And you increasingly feel that even without them drawing that line, then you should draw the line yourself. So you see, you're left alone, and they're also depending on you, and that dependency doesn't come. You're not providing adequately on time. You still have financial issue to deal with, not just the patients. That has impacted greatly into the mental health of the healthcare workers. In our own small ways, we've tried to put what you call safe shops. And those have not been forthcoming because the unions and the associations, without donor fundings and without assistance from outside, would be less than adequate. What would have been ideal was the government to factor in all these measures, that the physical health of a person does not just end with the physical health. The psychological, the mental health aspect of it are important. Just recently, we've seen them coming up with measures like tele-psychological centers, but even the uptake for these has been low, largely because of the perception now that the healthcare workers have towards the government.
Mtazamaji, dakika zikiwa zinakatika takriban 50 baada ya saa 4, tunaye mwenyekiti wa muungano wa madaktari nchini, Daktari Abidan Mwachi, ambaye amekuwa katika mstari wa mbele kuhakikisha kwamba wahudumu wa afya, madaktari katika taifa letu la Kenya wanafanya kazi katika mandhari ambayo yako sawa, wanafanya kazi wakijihisi kama ambaye wanafanyia kazi taifa la Kenya. Dakika zikiwa zimeyoyoma, nafasi unayoweza kuuliza swali, nafasi unayoweza kuzungumza naye daktari aweze kutupatia taswira kamili. Daktari, labda lengine ni hili, madaktari wa Kenya, wahudumu wa Kenya, je, wanajihisi kwamba wanafanya kazi katika taifa ambalo linawajali, wanafanya kazi katika taifa ambalo wanahisi kwamba, unajua, unaweza kama wale wanariadha, wakati mwingine anaenda katika mbio, anakimbia akitoa machozi, akishika ile bendera ya taifa lake. Nyinyi kama madaktari, nyinyi ambao tumewapatia maisha yetu, mnajihisi mnafanya kazi katika taifa ambalo linawajali?
Ismail, I think you have the answer to that question. But in as far as getting claps, kupigiwa makofi is concerned, then nadhani tumepigiwa makofi sana. Na kama hiyo inapaswa kutufanya tusikie vizuri, basi tungekuwa tumesikia vizuri kitambo. However, when you look at it, when doctors, nurses, all healthcare workers have not been paid their July salary deep into August. Healthcare workers do not have a reasonable risk allowance. Healthcare workers working at the front line don't have a reasonable insurance cover, that when they get sick, they have to pay from their own pocket. It's a suicide mission.
Kuna wakati niliona katika runinga na mlikuwa mnalalamika kwamba wawakilishi wa maeneo bunge wanapata mshahara wao, utapata ruzuku yao ni kubwa hata kuliko nyinyi ambao mmejitolea maisha yenu kivyo vyote. Mara umedungwa na sindano, nikawa sindano ikawa ndio sababu ya kifo chako, na utapata mtu ambaye yuko anawakilisha pengine watu kidogo. Kama ulivyosema, kuna daktari mmoja anaweza kuwakilisha watu 1,000,000. Daktari mmoja aweze kuwakilisha watu 16,000 na kuendelea. Swala kama hili, daktari, kama mtetezi wa madaktari, kama mtetezi wa huduma, unalizungumza?
Yes, it's true. We feel like our economic model, our way of remunerations and appreciating the people who really work for this country, the people who work hard, are less appreciated. And it wouldn't be a good point to do a comparative analysis. What will be adequate for me to say is that compensation needs to be commensurate to the kind of work a person does, the number of years a person has gone to school for, and the burden of work. If you're dealing with life and death, then it has to show in terms of remuneration. There's no other way. The clubs won't work for long, and the accolades will not work for long. What needs to be done is to put substance into it.
So tutarajia siku moja tumuone Daktari Abidan naye anasema kwamba kazi ya udaktari sitaki, niingilia kazi ya siasa, kama hali itakuwa hivi?
We'll cross that bridge when we get there.
Dakika mtazamaji ndio hizo zinazidi kuyoyoma. Tuje katika swala la mwananchi wa kawaida, daktari. Mwananchi wa kawaida katika swala hili zima la corona ana jukumu gani? Ana role gani kucheza kuhakikisha kwamba swala hili la corona tunaweza kupambana nalo kisawasawa, mbali na kwamba ni madaktari wamejitolea, lakini mwananchi wa kawaida jukumu lake ni lipi?
First of all, I'll start by appreciating the many Kenyans who've made it their own initiatives, including your own organization, to be champions towards tackling the pandemic down. That is how it's supposed to be. Doctors can only treat when it's already a disease, when it's already, it has already infected someone. But to tackle down a pandemic means that the correct information needs to get out. And the correct information getting out is a joint effort of the 7 billion plus people that live in this world. For every one person who spreads misinformation, for every one person who comes out with misquotations, that is very many people misguided, very many people misinformed, and it leads to an aberration of the efforts that are supposed to be put in place to tackle it. Kwa hivyo mwananchi wa kawaida, the very best should be a champion towards the end of the pandemic. If you've come up with a vaccine that has been tested by scientists, proven to be safe, please stop from spreading propaganda, rumors and myths, and get the correct help, get the correct message, get the correct information from the scientists. That is the only way you can help us, so that we also do not start tackling the pandemic, and at the same time we are tackling myths and rumors, so that the scientists and the healthcare workers are just left to tackle the pandemic. Be the champions. If you have a person who is hesitant in getting the vaccines, it's your role to convince them about the hard hitting stuff that corona is.
Labda daktari, unadhani kwamba serikali kuu pamoja na serikali za kaunti zimeshindwa kumwelimisha mwananchi kuhusiana na hili janga? Kwa sababu nakumbuka miezi kadhaa iliyopita niliweza kufika katika sehemu ya Kwale na nikajaribu kuzungumza na wale wanajulikana wanaitwa community health workers. Nilijaribu kuzungumza nao, wengine wakasema kwamba hawajawahi pata mafunzo yoyote kuhusiana na janga la corona, na hawa ndio wanaambiwa waende wakazungumze na mwananchi wa kawaida. Daktari, unaona kuna tatizo? Kwa sababu kama yule mtu akijitolea kuweza kuelimisha mtu kuhusiana na afya yake hajui kuhusiana na ugonjwa, je, huyu ambaye hajui kabisa itakuwa vipi?
Ismail, there's a study that was done that showed people asked, it was based in Mombasa by a civil rights group, and people asked, where do you mostly get information? 70% of them said they get it from the government. Then when a further question was asked, do you trust the government? 60% say they do not trust the government. And where does this mistrust come from? You see, when the government is putting up containment measures, that there should be no crowding, people should wear masks, people should keep social distances, and we should sanitize as adequate and as often as prescribed. And then it's the same government that is breaking those protocols. You see in big rallies, you see them shaking hands on TV, you see them holding all these night acts. Now you see, there'll be mistrust, and the natural reaction from the common mananchi will be to mistrust the government and to rebel. And that's what you're seeing. Yeah, you see? So even those ones who say that they have not gotten the information from the government, it's probably that they have gotten that information, but they do not believe it. They do not believe it because they see the government preaching water but taking wine.
Mwanzo tumezungumzia swala la chanjo za corona, na hapa ndio swala ambalo watu wamekuwa kilizungumza sana. Tueleze kuhusiana na chanjo za corona daktari, yanayojiri katika hizi chanjo za corona, uongo unaoenezwa na wananchi, faida za chanjo ya corona, athari ya chanjo za corona katika kimtazamo wa kidaktari. Kwa sababu yamekuwa yakijiri mengi, wengi tumepata malalamishi. Hivi ninavyokuja hapa tufanye mazungumzo, kuna mmoja ameniambia sasa hivi, kuna dada ameniambia hadi kufikia sasa hajaona siku zake. Aliweza kudungwa, alipata jab ya kwanza, lakini hadi kufikia sasa hajaona siku zake. So labda tueleze chanjo ya corona ni nini, athari yake, faida zake, yale yanaenezwa katika sehemu mbalimbali katika taifa letu.
And now you understand why I chose to speak in English, because it's really hard.
Exactly.
You're using putting those, but you'll bear with me. Coronavirus is a viral disease, goes without saying. And we've developed, the world of scientists have developed numerous other vaccines to attack viruses. And more recently, they're still in the process of developing a vaccine against HIV. So what the vaccine does is that it mimics the virus. It acts like it is the virus so that the body can produce antibodies. Antibodies are like soldiers that are meant to attack the virus when it attacks, when it gets to you. So this is what happens. A person who does not have, who is not vaccinated, when you get the viral infection, the virus gets into your body and multiplies. And when it multiplies, it gives you symptoms, and that is now where you become sick and you might die or get well. What a vaccine does is that it takes this virus, takes a component of it, and introduces it into the body. Because it's just a component of the virus, the body will produce these antibodies, the soldiers, and make the soldiers ready. So that in case you get an infection from the virus, the soldiers are ready to tackle the virus down. So that is, by and large, in simple terms, how the vaccines work. And there are over 17 vaccines now developed. In Kenya, we're using the AstraZeneca. And the major debate has been why we're using the AstraZeneca, whose efficacy is 67%, and not the Moderna vaccine or the Pfizer vaccine, whose efficacy is close to 95%, actually between 90 and 97%. And I think this is where the public gets it wrong. When you look at those figures, watu wanadhani kwamba sisi tunapatiwa zile vitu substandard. So you read and now you see being given a vaccine whose efficacy is 67, while other people are being given a vaccine like Moderna and Pfizer whose efficacy is 90 to 94. But to put it in context, those are not figures to be read just like that. They need to be put in context. Efficacy, this is what is done during the trials, that there's one group, let's say 100 people on this side, 100 people on this side. So this group are injected water or something we call a placebo, and this other group are injected the vaccine. So they're monitored over time and they see which of this side that didn't get the vaccine, how many got sick, and on this side, people got the vaccine, how many got sick. If more people on the vaccine side got sick than the side that didn't get the vaccine, then the vaccine is ineffective. So that explains the efficacy rate. And I will say, since it has protected 95%, so it's more efficacious. That is not true. The efficacy rate is not meant to tell us how effective a vaccine is, because there's a very critical component to these trials called timing. When you see the Pfizer vaccine and the Moderna vaccine, their trials were much early on before the virus got mutations, and they were majorly based in one country, the US. Maybe just a few went to Argentina and the UK, but majorly based, two factors, in one country, and when the vaccine did not have mutations. So the efficacy was 95% at a different time. Later on, the AstraZeneca and the Johnson & Johnson came in, and they, despite having low numbers, they spread their vaccine trials into many different countries, like South Africa. So you find that in these countries, we already had mutations. So ordinarily, the vaccines would face challenges in trying to contain the new mutations. But also another point to put across so that you understand that these figures mean nothing, they are just for the scientists, not for the consumer, for the end consumer, is that what is the end goal of a vaccine? The end goal of a vaccine is not to stop the infections, really. The end goal of a vaccine is to prevent the very adverse effects of the infection, which include hospitalization and deaths. So it's not so much more about the efficacy rates, it's about will it prevent deaths and severe infections. And that is true when you put all the vaccines now in context, forgetting the efficacy rates of between 95% and 67%. You find that all these vaccines have almost an equal capability of reducing both hospitalizations and death. Because it means nothing to me if I'm infected and I'm healthy. But it means a lot to me if I'm infected and I'll need to be hospitalized with severe disease or even die.
Doctor, what about the complaints we're receiving and some of wananchi wanasema kwamba they're facing some challenges wakipata hizi chanjo. Kama nilivyokueleza kwamba kuna wengine wanasema kwamba mtu anapata damu haitoki sawa, flow ya damu yake haiko sawa. Kwa dada zetu wanasema kwamba wanakosa hedhi zao zinakuwa tofauti. Mtu amekaa miezi miwili hajaona siku zake. Inaleta tofauti. Sijui kiupande wako kama mtaalamu, tatizo hili linasababishwa na nini?
Maybe those are few what you call sentinel events that it will really be hard to pin them down to the vaccine. Remember, 1 or 2 stories from the streets do not amount to much if they are not put on a grand scheme of things of a study of a big propensity. 80 million people in the US vaccinated, and such events have not been reported in large scale, so as to mean that the vaccine is not probably responsible for those. There are many issues that will make you not miss your periods, not necessarily the vaccine. So for you to pin down to the vaccine, you need to have ruled out all these other issues. Even stress alone, just mental, psychological stress. You know, it's a COVID period. Everyone is psychologically stressed. Even that alone can make you miss your periods. To pin it down to a vaccine will be becoming too unfair to the vaccine.
But the vaccine has a side effects.
Vaccine has side effects that are categorized as mild, moderate, and severe. The mild side effects are more. The mild side effects include pain at the injection site. You might have a fever that is manageable by taking fever medication. Some in the categorized as moderate side effects, you might have some rash. And when you go to the severe side effects, now you may get joint pains, you may get a rash, a cough. But those are manifestations that your body is mounting a response.
Dakika ndio hizo zikiwa zinayoyoma. Mtazamaji, una swali, naona tayari mwelekezi wangu ameweza kunipatia maswali hapa. Kuna swali kutoka kwa Dennis na kuna swali kutoka kwa Okado. Labda niulize tu kwa daktari. Ameweza kuuliza Dennis hapa, if you get the first jab, does the chance of getting COVID minimum? Ameweza kuuliza. Alafu na swali lingine anasema, after getting the vaccination, how long does it last? Labda kiupande wako daktari uweze kujibu maswali kama haya mawili.
True. Once you get the first dose, it reduces your chances of getting severe disease by a certain percentage, because after 2 weeks of getting the first jab, your body will accumulate enough antibodies, which the problem is they go down. The antibodies again go down with time. That is why you need the second dose. So it protects you a little bit, but now you need a booster dose so that the antibodies are adequate enough to give you proper protection. This is not the case with the single dose vaccine now being rolled out in the US, called the Johnson & Johnson. Now the correct name will be the Janssen vaccine, because it's developed by scientists called Janssen. Where you are single dose and you don't need boosters. However, what is increasingly being found, and if you're following Dr. Fauci of the United States of America, is that they're saying that even after the second dose, there might be a possibility of giving a third booster dose so that you mount your immunity properly. So true, after the first dose, you get some semblance of immunity. But for you to get proper immunity, second dose is required. And in the most vulnerable group, it might even go to the third dose, and so on and so forth. I've forgotten the second question.
Amauliza, after getting the vaccination,
yeah,
how long does it last? Muda gani itachukua pengine kuchapata ile chanjo? Itachukua muda gani pengine kufanya kazi ndani?
You see, that will largely be unknown because we're just 1 year into the vaccination. So I think in the fullness of time, once the research now has been rolled out completely towards the tail end probably of this year or next year, we might know how long the antibodies might last based on how the different populations react to the vaccines.
Kuna mmoja hapa anauliza, Obiero anauliza, what is Delta variant and why is it feared? Is it bad as said? Huyu ni Obiero anaweza kuuliza, alafu anasema, why should government allow PSV to carry full capacity? Hilo swali ambalo daktari pia umeweza kuulizwa. Anauliza kuhusu Delta variant na why is it feared, ni mbaya, na ameuliza mbona serikali waseme kwamba kuna corona na waruhusu watu magari ya bebe abiria kujaza gari.
Delta variant, Delta variant is a mutation. To put it in plain terms, we had the original COVID-19 that originated from Wuhan. As with any virus, they tried to mutate so as to survive. So it's mutated into the alpha, into the beta, so on. So we've reached the Delta variant. And right now indications are that we are going into the Delta plus variant of COVID. So it's a mutation from the original. Yeah, a few changes here and there in how it presents itself. What is known about the Delta virus is that it is more transmissible, that its transmissibility is somewhere close to chickenpox. If you can remember how chickenpox is transmissible, that is how the Delta virus is. Also, that if we are put head to head, the original Wuhan virus and the Delta virus, you find that the viral load, the number of viruses in a body, in a person with the Delta virus, will be more than the number of viruses in a person with the original virus. What this means to say is that the Delta virus multiplies faster. It is still not known whether the Delta virus produces more severe symptoms than the others, but preliminary discussion is that the Delta virus could be more lethal and more unpredictable because it's a new virus. Still, there's studies going on about it, but that's what I can say. About the PSV, I think the best person to answer that will be the people who came up with that idea. But for all intents and purposes, I don't think we are out of the woods yet. Putting measures that will counteract the containment measures that have been put in place before, especially in the middle of a spike, will not be a very wise decision. We don't know where the push came from. Maybe it was an economic movement. People felt like, there are spheres of the economy, like the political rallies that are going on. Why not allow matatus to go on? And even bar owners will now start coming up with their own models. But this is the wrong time to do it, in my opinion, as a medical specialist.
Daktari, kiupande wangu mimi hupenda sana masuala ya public participation. And ni sheria kulingana na katiba pia ya Kenya kwamba mwananchi anafaa ahusishwe katika mambo mengi. And tumepata hili swala la chanjo linatia wasiwasi. Kuna nyanya kule mashambani ambaye hajui chanjo ni nini. Yeye mwenyewe akiamua kachukua chanjo ya kawaida tu inakuwa changamoto. Na sasa hivi anaambiwa kuna chanjo ya corona. Na kuna hizo mifa ambazo zinatoka kwamba chanjo hii ukidungwa unafanyika hivi. Labda unadhani ni wakati, mbali na kwamba ni serikali za kaunti na serikali kuu ziweze kwenda kule mashinani, unadhani ni wakati wenu nyinyi madaktari kama muungano kuweza kuvaa makoti, kuweza kuvaa vile vitu vyenu vya kazini na kwenda kule mashinani kuelimisha hawa kina mama, wazee wetu, vijana ambao hawajui yanayoendelea katika hususan katika swala hili la chanjo? Kwa sababu wengi wanahisi kwamba, mimi nahisi kipande wangu hakuna ile public participation. Wananchi pengine waende kule waelimishwe, wafahamishwe kuhusiana na chanjo hizi. Nadhani kuna haja sasa hivi ya nyinyi madaktari kufika katika mashinani.
Yes, Ismail, you're very right. We are faced with a very unique problem that we have a virus and a vaccine to administer, and this vaccine is not administered to children. If it was being administered to children, you'll expect that their parents will be these low age to middle age who will have a better understanding in terms of doing their research over the internet. But we are faced with a vaccine that needs to be administered to older people who don't have access to such. So they are more rife to believing myths and what you call corridor rumors. And that comes in the backdrop where there's a lot of mistrust in the government. I think the question now addresses vaccine hesitancy, why people are reluctant or taking more time to get the vaccine. And to adequately answer that, yes, we need proper public participation. And it doesn't start with the politicians. It starts with people that the community can trust. Yes, the Mzee Nyumba Kumi, yes, the voice of reason there in that estate. The religious leaders, the people who are on the ground. Sometimes it could even be the low-key politicians like the MCAs who can be heard. However, our model has been a bit lopsided, where when you look at the COVID preparedness response teams across, it is infiltrated by security operatives as to indicate that, you know, we are putting punitive measures. You just look around. I've sampled several counties' COVID preparedness teams. There are county commissioners, OCS, OCPD. There is no proper public participation. There is no community health worker. There is no Nyumba Kumi from different estates. You know, local radios to spread the message. If a person goes to the local radios, again, it will be that top politician who is mistrusted. Yes? So there's a gap there. There's a dent there that we need to unbend in terms of who do we send out to take this information out. And the government also needs to just be frank with itself that it's not.
Wadhani hii ndio sababu ya wananchi sasa hivi mtu havai mask kwa sababu anaogopa polisi? Hataki pengine, yani unadhani hizi ndio sababu ama sababu nini? Kwa sababu imekuwa sasa hivi ukienda kule mashinani anakuambia mimi navaa mask kwa sababu nikionekana polisi nitaambiwa mpeane shilingi 500, nitaambiwa mpeane 2000. Kumekosekana nini?
Yes, you know, rebellion is human nature, and especially when now you see the measures are affecting your family, the measures put in place are affecting your mental health. Rebellion comes very, very naturally. That is why you see most of these people are more inclined to rebel, and they will only do it so that they're not punished. Because if the consequences of not adhering to the COVID protocols is punitive, right? You know, but then people will just do things to avoid the punishment. Yes, not really with enough knowledge that I'm doing this for myself and to protect other people.
Daktari, naona muda unazidi kuyoyoma, tuna maswali mawili matatu hapo kuweza kumalizia. Kuna swali ambalo limekuwa likiulizwa sana na watu wamekuwa kulizungumzia, hususan wafanyikazi wa serikali, wale ambao wanafanya katika ofisi za serikali. Kumekuwa na malalamishi kwamba watu wanalazimishwa kuweza kuchukua chanjo. Chanjo ni lazima kwako wewe kama mtaalamu ama ni mtu kujitolea? Na je, kuna vipengee fulani ama sheria fulani ambayo inamlazimisha mtu yoyote ambaye anafanya kazi katika afisi ama idara ya serikali aweze kudungwa chanjo?
You see, that is now where the government missteps all the time. The government cannot force you to take a vaccine. The government cannot force you to get tested. The Greece Declaration on Autonomy says that a decision as pertains to a human body who is of competent mind rests on that person, that individual. It's called autonomy. Anything to the contrary can actually be litigated upon under the law of torts. The law of torts is similar to, if you're forced to take a vaccine, that will be tantamount or equal to torture because you did it against your will without consent. And that consent, I can only persuade you, but coercion is also litigable under the law of torts. So I don't know if it's misinformation or deliberate blinding of one's eye, but no single government individual can force you to take a vaccine or even do a medical test. Even if it meant you yourself die, no single government individual can force you to do that. The only exception to that if you you not taking it is a matter of public health concern. Now those can be deliberated upon and situations put in place to mitigate it.
Dakika ndio hizo zikiwa zinayoyoma, mtazamaji, naona tuweze nakamilika, tunaelekea kufunga, lakini kuna lengine swali hapa daktari, nyinyi kama wataalamu na wewe kama msimamizi ama mwenyekiti wa muungano wa madaktari nchini, ni kipi ambacho sasa hivi kama madaktari mmeweza kujifunza kama wataalamu hususan wakati wa hili janga? Nadhani kama wataalamu ni kipi ambacho mmeweza kusoma, ni kipi ambacho mmeweza kukitumia, ni kipi ambacho mmeweza kukitoa, ni kipi ambacho mnadhani kinafaa kuongezwa zaidi?
I think the biggest lessons for us right now is that health is largely teamwork. Proper and deliberate efforts have to be put in primary healthcare that are not run by doctors necessarily, but community health workers and those people on the ground. That preventive measures has largely been ignored. But then again, when you come to the secondary treatment level, secondary and tertiary, we've learned that our countries are less than, are inadequately prepared to tackle diseases of these proportions. We do not invest in research, and when we do, there is a lot of pilferage. We do not have adequate facilities. We do not have adequate healthcare workers, and probably we've also not been able to network properly so as to create or strengthen a system to move up as a whole. Yes, doctors will be the health leaders, but without all these other components, then it's a system that is not foolproof.
Na labda hapa tulipo katika hii kaunti yetu ya Mombasa, unaona tangu corona ianze, nimejitayarisha kisawasawa, ama ni picha tunaziona kwenye video tu kwamba watu wamejitayarisha, lakini kwa upande wako kama mtaalamu, unaona tumejitayarisha kisawasawa?
It would have been a more interesting conversation if you were two here, but now I'm alone. I will say, this is how I'll put it. More and more of our leaders, when given a choice between style and substance, where style is how you do things, and substance is the importance of it. When given a choice between style and substance, they very first run for style. Yes, that is why you saw when devolution was coming in, all these counties were putting 50 plus ambulances on a football pitch. Where are they now? They're not there. They rushed to paint hospitals with no health workers. They rushed to buy equipment from China called the MES. We are paying 7 billion shillings every year to equipment that are not being used, simply because we wanted to say Lamu has a CT scan machine, has a dialysis machine. They've never been used for the last 10 years or so. So you're putting more importance on style more than substance. When you come back here, at some point you're being told you have 400 beds, and where are they now? They're not there. We only have 40, and those 40, only 5 doctors are there. And to tell you, those 5 doctors will not be there all the time. There are those ones who will be working at night, those ones who will be working during the day, those ones who are off, all right? So at any one given time, to manage those 40 beds, you'll have 2 doctors.
Kwa hiyo kiupande wako daktari unasema kwamba watu usema ndanganya toto, ni picha tu wanaziweka kwenye mitandao, ama ni taswira tu wanataka kujenga kwa sisi wananchi, lakini hali si kama tunavyoona.
Very far from it. It's very far from adequate. The photos are beautiful, I have to admit, and I will humbly admit that the photos are really beautiful. But what we've seen is more motion, but no movement.
Motion but no movement.
Yes.
Asante sana. Labda kukamilisha, kuna kama vuguvugu hili la kwa Mombasa, nyinyi kama muungano wa madaktari na wataalamu, ni lipi ambalo mnaweza kuambia angalau wakapata funzo, kwa sababu mavuguvugu ni mengi, makundi ni mengi. Labda kiupande wenu kama madaktari ama kama wataalamu, mavuguvugu kama haya kwa Mombasa yanaweza kusaidia vipi kuhakikisha kwamba wanaeneza swala hili la corona kwa njia ya sawa?
This is the first step. Media presence. You've educated a couple of Kenyans who will disseminate that information if they choose to. And also what Amnesty International is doing, organizing such forums, we will always be more than ready to come and give the correct information to Kenyans without the bias of being in government or the bias of being on the other side, but as doctors who are now in the arena. And also you have your own outreach as Muhuri. There are people you've assisted, there are people who listen to you and take your word hook, line and sinker. That is not a population to be ignored, because when you tell them, when you come out as Muhuri and say the vaccine is safe and we only expect mild to moderate symptoms, there is a population that will believe in what you're saying. You don't need to have a doctor in Muhuri. All you need to do is get... Sorry?
It's a core Mombasa.
Mombasa. Yeah. kwa Mombasa, you don't need to have a doctor. All you need to do is get information from the correct doctor. And now there are people who believe in Kwa Mombasa because they have seen you at work, and you will be able to convince them better than a professor will. Yes.
Labda kauli yako ya mwisho kwa wataalamu kama nyinyi, kauli yako ya mwisho kwa serikali kuu na serikali za kaunti, na kauli yako ya mwisho kwa Wakenya. Hizi sehemu tatu tazama.
To the doctors and other healthcare workers, we will continue hanging in there. We know the situation is less than perfect, but in this particular situation, I will want to urge you that let not perfect be an enemy of good. If we have a good enough position to work with, let's work with that good, even as we are aiming to achieve perfection. To the government, I think it's the correct time for them to stop shooting themselves in the foot and realize and also admit that their trust levels amongst the population is at an all-time low. They might give 10, 20 press briefings, but now is the time to get to the community people to spread the COVID news, because you need to vaccinate people. Also, if there is a need for review, you can see that we are waiting for vaccines from abroad, donations, the leftovers, after they get the second jab. So we were very happy that America has gotten its second jab. But now, what was left over, America is saying that we want to give our population a third jab. Let's open our research centers. Let's allocate enough money to where it matters. To the county government, I think this is a point for your learning, that substance is more important than style. Yeah? This is where the rubber meets the road. When we thought we could camouflage and put ambulances in football pitches to try to create an aura of something is happening. When the rubber meets the road, the truth will be laid out bare, as it has been. Yes, health is such a delicate and important matter to be left into the tentacles of pomp and color. Yeah.
Kenya kwa jumla.
Kenyans, COVID is here. COVID is real. We are into the third wave by a more mysterious variant called the Delta variant. And it is your role to not only protect yourself, but to protect those close to you. The vaccine is safe. It has been proven that it is safe. And the best vaccine, I know people are waiting for another vaccine. The best vaccine is the one that you're given. And you know, every jab on the shoulder is one person less that could be hospitalized and died from COVID.
Mtazamaji, ni mwenyekiti wa muungano madaktari nchini ukipenda KMPDU, Daktari Abidan Mwachi, ambaye tumekuwa tukizungumza naye katika ukumbi wetu wa Facebook kwa Mombasa. Tumezungumza mengi kuhusiana na masala ya afya, tumezungumza mengi kuhusiana na janga la corona ambalo sasa hivi limeweza kukumba mataifa yote ulimwenguni. Asante sana daktari kwa kuweza kufika, asante sana kwa muda wako. Tunakutakia kila la heri na tunaombea mzidi kupambana, kwa sababu macho yetu yako kwenu. Japokuwa kuna wengine hawaoni, lakini sisi kama wanyonge, wananchi wa chini, tunawahitaji sana. Tunazidi kuombea na msife moyo. Ipo siku mafanikio yatakuja. Kufikia hapo, nasema asanteni sana kwa wale wote ambao wameweza kushiriki katika mahojiano haya moja kwa moja. Kuna wengine kwa nyuma ya mitambo, dadangu Rachel Juma, asante sana. Cornel kwa kuweza fundi wangu wa mitambo, fundi wa mitambo wa nguvu kabisa, ambaye ameweza kupeperusha matangazo haya moja kwa moja. Tunawatakia kila la heri katika maisha yenu, na kama alivyosema daktari, corona ipo, tuwe makini. Asante sana daktari. Hadi Ijumaa nyingine, asante sana. Mimi ni Ismail Zema.